Pevonedistat is referred to as a NETylation inhibitor. In other words, by inhibiting NED8 activating enzyme, it affects DNA replication, cell cycles, and is involved with NF-kappa B signaling, eventually leading to cell apoptosis and cancer cell death. In this study, we enrolled 120 patients and randomized them to receive the combination of azacitidine and pevonedistat versus azacitidine alone, and followed them for a primary endpoint of event-free survival. Patients enrolled in this study were typical of those with these diseases with a median age of 72 years. About 67 of these patients had higher risk MDS, 17 had chronic myelomonocytic leukemia, and 36 had low blast count acute myeloid leukemia. Surprisingly, adverse events were almost identical in the groups receiving the azacitidine monotherapy or azacitidine plus pevonedistat, with no increased rates of fever and neutropenia, for example. When we focused on the primary endpoint of event-free survival in the intention to treat population, the median event-free survival for those who got the combination of pevonedistat and azacitidine was 21 months versus 16.6 months for those who got azacitidine, with a trend toward significance. The study was not powered to look at differences in overall survival. However, the overall survival numerically was longer for those who got the combination at 22 months versus 19 months for those who received azacitidine. When we focused instead on the population of patients with higher risk myelodysplastic syndromes, the event-free survival was significantly longer for those who got pevonedistat and azacitidine at 20 months versus azacitidine alone at 14.8 months. The overall survival was numerically longer at 24 months for the combination versus 19 months for azacitidine alone. For those patients who had acute myeloid leukemia, there was a trend towards an improvement in overall survival for those who got the combination of pevonedistat and azacitidine at 24 months versus 16 months for those who got azacitidine. Our conclusion from this study is that across all endpoints of outcome, there was an improvement for those who got the combination of pevonedistat and azacitidine versus azacitidine alone, and the combination was well tolerated, which allowed patients to get it for a long enough course to appreciate those improvements in these endpoints.